Many patients come to our office and they ask us, what's the difference between a tooth-colored filling and a silver filling? And that's a good question because they're both legitimate procedures, but there are a lot of information I think a patient needs to know to decide which they prefer. On the silver filling front, they've been around for many, many years. Silver fillings the tooth is prepared and the silver is placed into the tooth. Over time, the problem is that silver fillings begin to fail, and they begin to fail pretty quickly. First of all, they begin to absorb moisture, and as they do, the filling begins to expand. And as it expands, it acts almost like a wedge in a piece of firewood. It begins to kind of crack the tooth, and that could lead to actually the tooth breaking. I would say that the majority of teeth that we put crowns on nowadays are because a silver filling has caused a tooth to crack, and that silver filling maybe was placed 10, 15 years ago. So it causes a lot of teeth to break. The other thing with silver fillings is that over time, right at the edge of them, what we call the margin, they begin to leak. So bacteria can get under them and more decay can form, and that can sometimes lead to a larger procedure being needed like a crown, or even a procedure like a root canal needing to be done, which we would prefer not to do. The tooth-colored fillings are very, very different. They're made of what we call a hybrid composite material, which is the standard of care today. And what we would do is we would prepare the tooth by taking out the old cavity. The nice thing about tooth-colored fillings is we don't have to take a lot of healthy tooth like you would with a silver filling. You just take out the area of the decay, we etch the tooth, we bond the tooth, and then we place the filling material. And it actually almost fuses to the tooth. It becomes part of the tooth. A silver filling just kind of sits inside of the filling preparation, and it's in effect leaking from the first day. A tooth-colored filling becomes part of the tooth, and it's tightly sealed. So that's one benefit. The other issue is that tooth-colored fillings don't tend to expand. They don't absorb moisture, so they don't expand, causing that cracking pressure that silver fillings do. So I've never personally seen a tooth, say a posterior tooth, that had a brand new tooth-colored filling and had never had a filling before, that it broke because of a tooth-colored filling. I've just never seen it happen, and I haven't done a silver filling since 1994, so for a long time. The other issue with tooth-colored fillings is that over time, the surface of them, what we call the surface polish, gets better. As you function, as you chew on that tooth, the composite filling actually becomes more polished, and it becomes better. Silver fillings are the opposite. The more we chew on them, the more they become damaged at the margins and damaged on the surface. So overall, that's why we choose tooth-colored fillings for all our patients. They're stronger, they last longer, they keep a good seal, they keep a good polish, and they don't cause teeth to crack. And we want to give the best to all of our patients.